welcome to Healthy Living, and I'm Stacey Young, the Customer Service Director at Western Baptist Hospital. Today's guest, Dr. Amber Savells, sorry about that. Good morning, and thank you for joining us today. So excited to have you because there's been so much information out there for women with regard to health issues. You know, we're really kind of inundated with stuff that's on the internet, magazines, news shows, and sometimes those messages can become a little bit confusing. So I really wanted to hear from you this morning about what you see as some of the biggest health issues facing women today.
It's true that patients are overwhelmed with all the information that they have available to them, and part of that's good and part of it's bad. They come in with very educated questions sometimes, but they're also very confused by the mixed messages they've gotten from different arenas. I think it's great that women are hearing a lot about screening lately. I think that one of the things that patients are hearing more and more about is the new Gardasil vaccine, which has been helpful. And breast cancer screening recommendations have just recently changed in the past 2 months. And so I think that's an important thing that information is being sent to women about.
Great. Well, tell us more about the breast cancer screening changes. What are those now?
So there used to be a lot of conflict about what women should do between the age of 40 and 50. The two major organizations that provided screening guidelines couldn't agree on whether that should be every year or every other year, and so it left us in a difficult situation. A lot of times we just gave the patients the choice, but now everybody agrees that mammograms should start at 40 and be every year.
Great, great. And we know that that kind of prevention is truly the best medicine.
Absolutely.
Not to be cliche about that. You know, I know that you're committed to women's health, and I'm sure that in your office you see a lot of busy women, working moms who are trying to juggle hectic schedules, do all the right stuff, and still maintain a healthy lifestyle. You know, you're a working mom. What are some tips that you could give busy ladies to make sure that they don't let themselves go in terms of their lifestyle?
You have to make it a priority. Women always put themselves last, and in trying to take all the kids to all the places they need to be and manage the house and do everything that they want to get done in the few minutes they have here and there, they really do put themselves last. They don't make their own health a priority. Sometimes they'll skip doctor's visits, miss appointments that they needed to come to, overlook some of their routine screenings, but on a day-to-day basis, they don't make time to exercise like they should, and they don't eat as well because when they're pulling through the McDonald's drive-thru to get something for the kids, that's what they end up eating for supper too. And people are just busy, but diet is probably the biggest area where patients and everybody really lets their busy schedule force them to make bad choices.
And you know, in talking about diet, and I know you're a big proponent of exercise and staying focused on that, that goes into that whole idea of preventing disease, you know, stroke, heart disease, high cholesterol. What are some of the most common health issues that you see women facing today? You know, we think breast cancer, but what about other health problems? Unfortunately,
the biggest health problem that we see on a regular basis is one that patients don't really acknowledge, and it's just the obesity itself. 60% of the adults in this country are now obese, and almost half of those are in the morbidly obese category, and patients don't really see that as a health issue. I have patients come in and see me all the time, and I'll say, how are you doing? Has anything changed since last time we saw each other? And they'll say, nope, I'm perfectly healthy, except I'm fat. And unfortunately, patients don't see that as a problem, but it really is the precursor to the diabetes and the high cholesterol and the strokes and the heart attacks and all the other problems that come later, and people just don't see that as a health problem, unfortunately.
Well, and for women who are of childbearing years and are hoping to become pregnant, how does obesity play into their ability to become pregnant?
It really does decrease your chances of getting pregnant if you're trying to get pregnant. And once you have achieved pregnancy, it really does increase the chance of having complications during your pregnancy.
So some tips for women then are really watch your diet, for sure. Squeezing that time for exercise, certainly. So looking at other things like family history, how big a factor is that for women to really look back and see, you know, what did grandmom have in terms of heart disease and things?
It's very important. It definitely has a lot to do with predicting what your biggest health problems are going to be. Unfortunately, it's kind of a double-edged sword because it makes you feel like you're behind the 8 ball already and this problem's coming anyway. And so a lot of patients will view it as almost something they can't fix, and so that almost discourages them from trying to make healthy choices because they feel like it's coming anyway. But it really is important to look at your family history, and maybe that does mean that you have to work harder to try to avoid some of those health problems that relatives have had.
And you know, another thing that I think we often overlook, particularly as women in our schedules, is just that annual checkup. So what could you tell us about why is it so important to see your doctor at least once a year?
So many women are young and healthy and don't really have a primary care doctor. We are the primary care physician for a lot of young and healthy women, especially those women in their childbearing years. They don't have enough health problems that they see an internist or a family practice doctor on a regular basis. So it is important to come see us, let us make sure that nothing's really changed, and sometimes things will change so subtly and so slowly that you don't really notice it unless we start asking you specific questions and try to elicit some of those symptoms that make us more concerned. It's also important to just get your routine screening, the pap smear, the breast exam. Unless a gynecologist does your exam every year, you're not getting screened for ovarian cancer because a physical exam is the only screening test for ovarian cancer.
And is that a big problem even in our region? Do you see a lot of women who are getting diagnosed with ovarian cancer?
I don't think it's any higher here than it is in other areas. Unfortunately, most women who get diagnosed with ovarian cancer do so at a late stage. About 70% of women who have ovarian cancer aren't diagnosed until it's stage 3 or stage 4.
Wow, good. So developing that relationship with your physician, so important over the long haul, correct? And maintaining that focus on a healthy lifestyle. When we come back from the break, I really would love to hear a little bit more from you about the opportunities that you have to use technology to take care of patients. So we're going to hear a little bit more about the Vinci Robot, which is one of your specialties, available at Western Baptist Hospital. So when we come back from break, we'll hear more from Dr. Savells on this greatest technology we have. Welcome back to Healthy Living. I'm Stacey Young from Western Baptist Hospital. One of our local OBGYN physicians, Dr. Amber Savells, is with us today. And we want to take a moment to talk about technology. Gosh, things have changed a lot in really a short amount of time.
Definitely.
And one of the things that the Western Baptist has invested in is this Vinci Robot. Seen a lot of advertising about it, but tell us about that technology and how it applies to women's health.
The Vinci Robot has really changed women's health a lot over the last couple of years. So many women who used to have an abdominal hysterectomy can now have a minimally invasive surgery, and the number of abdominal hysterectomies in this country has gone down dramatically in the last 10 years because of it.
And so what's really the benefit? We talk about an abdominal hysterectomy, you're talking about a much larger incision.
Absolutely.
For the patient. With the recovery time, it has to be greatly reduced with a minimally invasive procedure. What do most women see in terms of their recovery time?
Most women who have surgery with the Vinci Robot tell me that they have pain for about the first 45 days, and then after that they describe it as more of a soreness. And people seem to be pretty consistent in distinguishing between pain and soreness. Most patients tell me they take their narcotic pain medicine for that first 4 to 5 days, sometimes a little bit longer, but not usually. And most people can be back to most of their normal activities about 2 weeks out.
So are there certain criteria that a woman has to meet to be a candidate for using the robot?
The robot is great for surgery for anybody who would need that abdominal hysterectomy. It's still not the best approach for every woman, and the least invasive form of gynecologic surgery is a vaginal hysterectomy. So if a woman can have her surgery without any incisions on her abdomen, she's going to feel much better because those women feel great a week or 2 out from surgery. But if you're not a good candidate for that, and if you have to have a procedure that's going to be performed with an incision, this is the less invasive form of that. And
so, you know, we talk about a robot, and some of us really may envision something that you would have seen on a space movie 20 years ago. What is the robot really?
The robot is really just a console that allows the surgeon to manipulate the instrumentation from across the room. The purpose of that is to give you better dexterity and better control. The robot actually ratios the surgeon's motions to the motion of the computer, and it makes the motions more fine and more controlled. Patients do envision it as something that you just walk in and hit the hysterectomy button on and then leave. I have patients ask me all the time, now, are you going to be in the room, or will you be close by? So, well, it doesn't really do anything on its own. Without the surgeon sitting at the console, the machine actually won't move. And one of the safety features is that unless your head is engaged into the console and breaks a laser beam, the machine can't move. So not only does the surgeon have to control it and tell it to do everything, it can't even accidentally be hit or budged without someone sitting engaged at the console.
Gosh, that sounds fairly complex. What kind of training did you have to go through to be able to use this kind of technology?
The training takes several months. You have to go through several different phases. The first phase is a computer phase, and then there's a hands-on training lab that you do so many hours of manipulation with different little toys and rubber bands and things like that. Sewing practice, and then you have to do a live cadaver lab before you're allowed to do cases, and then you have to have so many proctored cases. For surgeons who are already out in private practice, where there's not a robot, they have to do a considerable amount of travel. There are only a couple of Da Vinci training sites in the country, and so there's quite a bit of travel that's involved, and it can be kind of cumbersome. Fortunately, I had the opportunity to train and be Da Vinci certified before I ever came to town, so it was very nice that there was a robot here and that I came to town already trained to use it.
And that really is, having that robot available here is really a great benefit for people in the community, because it eliminates travel often to much further destinations to have this kind of surgery.
Absolutely.
Do you find women are seeking out this type of technology? Are
Yes.
people doing their homework?
They are doing their homework. Some patients think that it's the best thing because it's the newest thing, and it's still not. The least invasive form of surgery for women is vaginal surgery, and if you're a good candidate for that, that is still the better surgery. This is not the best for everyone just because it's the newest.
Right.
But it's a great option for patients who would need an open incision.
And what are some of the health issues or symptoms that might drive a woman to the doctor that would even have you looking to the area of hysterectomy? Because that is a big surgery.
It is
right?
a big surgery. It's a major surgery, and sometimes we overlook that now that it can be done minimally invasive. If you go home with just a couple little incisions that are about as big around as your finger and you feel pretty good a week or two later, people tend to forget, and family members tend to forget, that you did just have major surgery. Sure. The most common reason that women in this country have hysterectomies are either fibroids, pain, heavy bleeding that's difficult to control, or that leads to anemia or transfusions. Sometimes patients will have a hysterectomy just because they have painful intercourse. Those are the most common reasons that women have hysterectomies.
So if a woman is suffering from any of those conditions, how serious can that be if left unmanaged? Talking about particularly fibroids, pain.
Sure. Pain impacts a lot of women, and they feel like they just have to deal with it and don't have any choices. Their mother had it or a friend had it, and they feel like it's just kind of part of life and that's just part of being a woman, but that's really not true. As quickly as women can recover from this surgery and be back to almost all of their routines, activities 2 weeks or 3 weeks out, it's a very fixable problem.
And are there other things that a physician would consider before running straight to surgery?
Absolutely. Surgery is always the last choice, and I always give my patients all of their options. The least invasive thing that a lot of women can do is medication. There are other outpatient surgery procedures that can be performed for some women, and if you're a good candidate for that, I usually encourage women to try that.
Good, good. So when you kind of look at your practice, and you've been to a lot of hospitals in the country and had a lot of training, talk to us more about, we spent a lot of time talking about the things that are available locally for women. How does Paducah stack up in terms of availability of really the best and latest in medicine?
I've been very impressed with what Paducah has to offer women as a community setting, and especially a rural community. There are not very many things that women can't get here in Paducah. I occasionally have patients who have to go to Nashville or St. Louis, but it's very rare.
Great. And I know that as a medical community, all of our physicians are well connected to other facilities who may offer a more specialized care. You know, how do you stay up on who's doing what in the world of OB/GYN medicine?
It's hard sometimes because it changes so fast, but we try to stay connected with people who are in the closest driving distance, and then your natural tendency is just to stay connected with people that you know from wherever you've been.
Right, right. So to kind of wrap up this whole idea of technology, what kind of advice would you give to women who may be watching this program today and saying, you know, I'm just not feeling that great, I do have some symptoms that you've discussed. What would you advise them to do?
Come talk to us. Let us give you your options. It's our job to explain to you what's going on with your body and give you your choices and help you make a knowledgeable choice. It's not my decision to decide. It's my job to educate you and help you make a good decision.
Good. So women need to know they're not the only person that's ever experienced certain physical concerns that they may have, and you know, embarrassment should not keep us out of the doctor's office.
Absolutely not.
Good. Good. Thank you so much for that advice. We're going to take a quick break and then we'll be back to talk a little bit more about a new service available here in Paducah at Western Baptist Hospital to help out brand new mommies. And so I will look forward to hearing some information from you on that. So we'll be back in a moment. We're back on Healthy Living. Thanks so much to our guests today. We've enjoyed all that you've had to say. Dr. Savells, one of the newest things that's available in Paducah is a service line, what we call maternal fetal medicine. That may not be a term that the community as a whole is as familiar with. So can you help us understand a little bit more about what that means?
Sure. Maternal fetal medicine specialists are obstetricians who have done an additional 3 years of fellowship training in high-risk pregnancies. They're trained to just manage women who have complicated pregnancies or other health conditions that could complicate their pregnancy.
And in the past, before this specialty was available here, what happened for women who were in that high-risk category?
Women had to travel to either Nashville, Louisville, or Lexington to see the closest maternal fetal specialist.
And would those trips be often, you know, weekly,
Could be.
monthly? Gosh, that's a strain on families, I'm sure.
Yes.
So we've got this now available here. What does that, in addition to reducing travel time, what are the other benefits that are available for women?
I think women can just be more comfortable. If you're in a gray area where it's unclear whether you should be managed by a general practitioner here in town or whether you need to be consulting with a specialist somewhere else, now you can do both. Now you can see that doctor that you have a relationship with and that's delivered your other babies or your friends or your family members, and you can stay with that doctor that you know and trust and know that they have somebody to consult with, and there's somebody here in town that can see you just as needed. So a lot of our patients will stay with us for their pregnancy care and just have a one-time consultation or see the maternal fetal specialist maybe twice during their pregnancy to just check up on things and make sure that things are going okay.
Gosh, and as a physician, I guess that really helps you feel more, I guess competence not really the word, but you've got all the tools you need in your back door.
You know that woman has what they need here available to them.
Good. So the other thing, when we talk about high-risk pregnancies, often I know that may lead to an early delivery.
Yes.
And Western Baptist has recently opened a neonatal intensive care unit. So can you share with us sort of your perspective on that unit and the impact it has to local families?
This is great for our families. The closest NICU before was a couple of hours away, and the hardest thing for a new mom is to be separated from her baby and not be in that same place. And yes, moms could go and stay wherever that baby was. But if you have other children at home, then you're having to pick between where you need to be the most and who needs you the most. So this is a wonderful thing for moms, because now they don't have to be separated from their babies if that baby is born too soon and we can't stop that premature delivery.
Right. And I would think that, you know, the care team that I've seen in our hospital has really been focused on the totality of the care, mom and baby. That's really one focus, and you have lots of doctors involved. So as a care team, how do the physicians interact with one another to take care of both patients?
We have great communication with the NICU staff. There's 2 nurse practitioners that are in the hospital around the clock. There's always one of them there. And we have a new neonatologist who has moved to town and is the full-time attending staff in the neonatal unit. So we communicate with them a lot. If we anticipate that there's going to be a complication or a premature delivery, we start talking to them really early and have them come talk to mom. It's great for mom and dad to hear from them before the birth ever occurs, so that they can kind of anticipate what kinds of problems they're going to have based on how premature their baby's going to be. And that helps them feel less unfamiliar with what's about to happen.
Certainly, because I know anxiety plays a role in how well we're going to recover from all of this. So reducing anxiety obviously is going to improve that communication with the patient and the care team. So, you know, one of the things that we've seen in the past is, you know, moms deliver and baby does have to go to a higher level of care. And if mom had a C-section, it could be a couple of days before she can rejoin her child. How difficult was that for you to see that kind of stress on families?
It was hard to see that the first couple of years I was here, because I wasn't used to that. I was used to moms and babies always being in the same place. So it's hard to see moms separated from their babies. But it's great that that happens very rarely now.
Good. So when is a time that you would see that a baby would not be able to stay at Western Baptist and would have to go to a higher level of care?
NICUs come in different levels, and our NICU is capable of keeping babies that are 28 weeks, and unless there's an immediate surgical need for that baby. Any baby over 28 weeks is probably going to be able to stay here, unless the NICU is over capacity.
Does that happen very often? Or do we have that many really young babies?
The NICU is not just for premature babies, and so even babies that are term or near term, if they're having other complications, feeding issues, problems maintaining their temperature, or problems keeping their oxygen level high enough, may still get admitted to the NICU. Prematurity is definitely not the only reason that babies need a higher level of care.
Good. So that's great to know that's available for anyone who may run into that kind of issue. So is it a busy place?
It's a very busy place. It's a very busy place. The NICU is almost full all the time and was actually closed a couple days last week.
Wow. So that service was certainly needed for our community.
Needed very much.
And I know the medical staff is grateful to have that around.
Yes.
So, good. Are there things that women who may be pregnant or planning to become pregnant need to think about in terms of risk reduction? Are there things that you can do during your pregnancy to kind of lower that risk for premature birth?
One of the behavioral changes that could be made that most dramatically affects the prematurity rate is smoking. Smoking during pregnancy increases the chances of a premature delivery pretty dramatically.
Okay, and so we know there's smoking replacement therapy. Is it the nicotine itself or the other factors that play into that? So if women who are smoking and want to quit, do you recommend that?
There's mixed opinions about whether or not nicotine patches or other nicotine replacement is safe for pregnant women. The problem with that is that a lot of the patients, pregnant or not, who start using nicotine replacement smoke on top of it. And so that is a toxic level of nicotine for baby. If you can do it and not smoke, I'd prefer for you to have the patch than to smoke, because it is the other toxins and chemicals that are probably more dangerous for baby. But so many times patients give in and will smoke on top of it. And so it really means that you have to know your patient and they have to be able to have an honest dialogue with you about how well they're maintaining that abstinence from their cigarettes.
Certainly. So the best advice is just stop smoking.
Don't smoke.
And protect that baby.
We'd prefer for you to not be smoking before you get pregnant.
Certainly. Are there other risk factors that are within a lady's control?
The next most common reason that patients have premature deliveries is a history of premature deliveries, and a lot of times we don't know why a patient has premature deliveries, but somebody who's already had one premature delivery is much more likely to have another one.
Okay, so definitely you want to talk with your doctor about
Early
those
care,
issues.
early prenatal care, and us having a good history so that we can perform extra surveillance is the best prevention.
Good. And then I guess knowing that you've got services available should you need them with the maternal fetal medicine program, with the neonatal intensive care, to help have easy access to care that's needed for patients.
And there are a lot of things that we can do to help prevent it. Just this year, the FDA has approved a new drug that we give pregnant patients on a weekly basis to help prevent that premature delivery. I don't have to know why the last one happened, but if you had a premature delivery, we can give you medicine to try to keep it from happening again.
Great. That's outstanding for moms. I know, that's a really happy time in life, and we want to make that as pleasant and stress-free as possible. Great. Well, thank you for that information. Before we wrap up today, I really wanted to, we've talked about a lot of different topics, a lot of important information for women. So I'd like to recap a little bit and go back to something you mentioned early on in the show, which was the Gardasil vaccine. Can we talk a little bit about that before we close out today's show?
Sure. The Gardasil vaccine is a new vaccine against HPV virus. Human papillomavirus is a sexually transmitted virus that causes genital warts but also causes cervical cancer. And women are encouraged to get the Gardasil vaccine before they turn 26. It's not approved for administration after the age of 26, but it's recommended that girls be given the Gardasil vaccine when they're 11 or 12. For the past couple of years, this has been a strong recommendation that we've made to all of our patients, talking to their daughters. I would ask a lot of my patients, do you have any children, and how old are they, and do you have daughters that are about to become teenagers? And just this year, the FDA has approved it for boys. So boys and girls are both now eligible to get Gardasil vaccine at age 11 or 12.
Wow. Good. That's great information. Now, I know that we've got a lot more information available for the community. If you visit westernbaptist.com, our website is just loaded with great information. You can also find information about our medical staff and those physicians who would be able to help you with additional questions. So we'd love to send people that way. And I know that you would be happy to, if patients need information, call your office.
Absolutely.
Set up an appointment. Really great to have you with us this morning. Appreciate all of the fine information that we'll have for women and families in this community.
Thank you for having me.
So thank you so much for your time.